Hello, I'm Professor Ross Hommel from Griffith Criminology Institute. It's my very great pleasure today to have a brief discussion with Dr. Abby Fagan. Abby's a criminologist who's visiting us from Florida, University of Florida. She's also a distinguished prevention scientist, which is an odd combination for criminologists. Most criminologists write about crime or about the criminal justice system, but they don't have the extensive knowledge about how to actually stop young people and children getting involved in antisocial behaviour and crime and drug problems that Abby has amassed over quite some years of working in communities. So we'll be talking both about her general research in criminology, but more excitingly perhaps than that even, her work in what to do about it. And particularly obviously from her experience working in the US, but we'll have a little discussion about what's different in Australia and what's similar and what the potential is for similar prevention work, crime prevention work here in Australia. So I'm going to ask Abby a few questions and we'll have a really interesting discussion. Abby, what prompted you to come over to Australia this time? I know you've been here before, but why this particular visit?
Yeah, so I did do a postdoc here in 2001 to 2003, actually at the University of Queensland, competitor university.
They're our good friends.
And I first met Ross Hommel at UQ, when I was at UQ. So I was very excited to come back and happy that I was offered an invitation to do so, to speak with you and your team more about prevention science. As you mentioned, there's a fairly small body of people who intersect both criminology and the world of how to use criminological research to prevent crime and related problems. So I was happy to come and speak more about our common efforts to work in those fields of study.
And Abby, when we talk about prevention science, this is an odd term. I mean, we have all sorts of sciences in this country that we've heard about, but I don't think many people have heard about prevention science. What does that mean?
It's a pretty new discipline too, so the word is just starting to get out. Prevention science is a multidisciplinary field of study that is interested broadly in preventing a range of problem behaviors, whether it be crime, substance use, things even like early sexual initiation, teenage pregnancy, and also promoting healthy behaviors and development. Typically, prevention scientists focus on understanding what causes those problems to occur and then using that information to target and change those causes. So if we know, for example, that being abused or neglected as a child will increase the risk of future mental health problems or substance use, we can try to prevent child abuse from occurring. So you're targeting the problems before they lead to, you're targeting the causes before they lead to the problems.
Which is a terrific idea, but how the heck do you stop child abuse and neglect? I mean, doesn't that just raise another whole can of worms?
It can. This is where the science part comes in as well. So we use science about studies that have investigated the causes, but we use that information to develop interventions that will reduce those risky contexts and attitudes or characteristics.
Can you give an example of a successful approach to doing that? I think there'd be a lot of interest in that.
One of the best known examples, it was a program developed in the United States, but it is well known here too, is called David Old's Nurse Family Visitation Program. I like to bring it up because it's probably the earliest you can intervene to prevent the problems of substance use and delinquency from occurring. In his program, he uses registered nurses to provide support to low-income pregnant women, usually in their teenage years, who don't have a lot of support or knowledge about how to take care of themselves during pregnancy, how to further their own educational and career goals, and then when their children are born, how to create healthy, warm relationships with their kids that promote attachment, avoid problems like abusing or neglecting their children. That program has been tested and rigorously evaluated, hence the science part. Again, you've got to evaluate these types of initiatives to make sure that they really work. And when he followed the kids from those mothers up over time, he saw that the children were less likely to be arrested, to engage in alcohol and drug use. The moms also benefited as well.
And presumably didn't maltreat their children as often.
Right, they had fewer incidences of child maltreatment. We can also intervene later in life. Another very well-known program that was developed here in Queensland is called Triple P. It's also for families. It also teaches healthy relationships between parents and kids, and it has been shown to prevent children's substance use and delinquent behaviors.
This is really interesting. It's not what we hear about on television, in the press, about crime and crime prevention. Why is this the best untold story in the world?
Well, I like to think the word is getting out, but again, it has been slowly infiltrating criminology. In criminology, when we talk about crime prevention, we're often still talking about a more reactive type of approach where we make more arrests. We put more police officers on the streets so that we reduce crime. But from a developmental point of view, we want to intervene earlier than that. We don't want to wait till people engage in the behaviors and then stop them. Maybe, we might have some luck with reducing future crime, recidivism, but it'd be better to target kids before they get started down that path because it gets more and more difficult to then intervene.
Right. Okay, well look, that's really, really interesting. Could you tell us a bit more about the kinds of projects and research and work in communities and so on that you've been involved in yourself?
Sure. So two of my big career hallmarks to this point have been, first, back when I was in graduate school, I had a really good opportunity to work with one of my mentors, Dr. Del Elliott, on a project he called then Blueprints for Violence Prevention. Yeah. This was really one of the first attempts to look at programs that had been created based on information about what causes violence, seeking to intervene with those causes, and then evaluated and shown to be effective in reducing violence. So as a graduate student, I got to read many, many evaluation studies, critically assess whether or not they were good studies, and then summarize their findings. And what eventually developed is a very user-friendly website called Blueprints for Healthy Youth Development. The focus of the website has changed a little to looking at all kinds of outcomes, not just violence.
Well, presumably if we promote good outcomes for young people, bad things are less likely to happen.
Right, and we're not always just concerned about stopping bad things. It'd be even better to promote good outcomes like employment and education and so on. So Blueprints has been really innovative in creating this list. We call it an evidence-based registry. There's now quite a few really, that have been put together by various institutions in the United States. They typically focus on different outcomes depending on who has created them. In education, we have one called What Works. We have one actually more specific to crime that's been developed by the National Institute of Justice called Crime Solutions. And they're just really user-friendly repositories that you can go to if you're interested in preventing something.
Right, but they sound like they've all been developed in the United States. Now, how do we know that any of those wonderful programs that are in these registries are going to work if we transport them? You mentioned Triple P, that's an Australian native.
Yes.
But what about nurse home visiting or any of these other programs? Are they going to work if we take them out of the US context?
The question is a really good one, and it's one of the cutting edge topics right now in prevention science. We know a little bit about that. We could use more information. What we really need to do is see what happens when we transport a program from one context to another. That could be nationally, or it could even be a program that was designed for a certain racial or ethnic group now being implemented with a different group. In many cases, those programs do seem to have transportability.
Yep.
And they'll have effects across cultures and across nationalities. Triple P has been used in the US and shown to be effective, been used in Australia, been shown to be effective. Other programs have been used across Europe and the United States.
Right.
So some of these programs have been trialed in other contexts and shown to be effective. Some cases the effects are not as strong, which suggests you might need to tailor them and alter them a little bit to make them more relevant to the context.
So we should be doing more in this country to look at what's there in those registries. I think we have used David Old's program in this country. I've read about that, and we're getting quite good results
That's great.
In both Queensland and New South Wales and other places. And of course, Triple P is all over the place at the moment with government billboards encouraging parents to get involved. So it's really good to hear about these developments. What about your own getting your hands dirty? What have you done?
Yeah, so probably the most relevant to why I'm over here right now is a community-based prevention system that I have been working with for a number of years called Communities That Care. And what it is designed to do is to assist communities to build their own capacity to understand what are the problems going on in their communities with youth involvement in problem behaviors like crime and substance use. What are the factors that lead to those problems? These are not necessarily the same across every community, so we help communities collect data to assess risk factors and protective factors that that community's youth are reporting as their everyday experiences. Then the community decides how they're going to intervene to solve those issues. So then they would go to a registry like Blueprints or one of these other areas of information and select interventions that have been shown to work and implement them in their own communities with their own kids.
Sounds complicated.
It is. It's not a magic bullet. Unfortunately, we don't have that in prevention science yet. It takes work. This is what we call a community mobilization strategy. So the first challenge is getting everybody together who's interested in healthy youth development, getting them to talk to one another, getting them to agree on what needs to be done, and then taking action to actually make it happen. It's not an easy solution.
But when communities do this and they succeed in getting around that cycle of action that you've described, what happens? What's the evaluation showing?
Well, in our study, we saw results, and we did a very well done randomized controlled trial where we had some communities doing this model, Communities That Care, and similar looking communities who were just going about their everyday business as usual. And we followed kids up who lived in those communities over a dozen years, and we found that communities that used this framework were able to delay the onset of some of these problems, which is important because the earlier you start engaging in the problems, the more likely you're going to go on to continue engaging in them. We also saw that the community agencies were selecting interventions based on data, data about what was needed in that community and data that showed the intervention actually could work.
So data-driven decision-making, is that what you're describing?
You got it. We promoted data-driven decision-making. We saw more collaboration across agencies too. So all the pieces were working as intended.
Well, that's hitting all the buttons for the community and school sectors at the moment. They want to all collaborate, they want to use data, they want evidence of impact. So sounds like CTC, Communities That Care, is something we should also be looking at.
Well, I know it has informed your work here and across the country, and I think the premise is solid. It's based on prevention science, and it's a framework that can be adapted in some ways, and you're doing some of those adaptations here. But the underlying foundation is the same. Use community members to solve their own problems, but give them the information and the capabilities they need to do data-driven decision-making.
Excellent. Now, all of that makes you sound like a very, very useful and learned but serious young woman. I guess you do other things as well, not only in your own personal life, but in your research that is all about researching these issues of what causes crime and how the criminal justice system responds to the kind of stuff criminologists routinely do. Do you want to say a little bit about that?
Sure, and these two things do go hand in hand. So I do some of that empirical work to identify some of these causes of crime. What I'm mostly interested in, first of all, are gender differences. One of the things we can say with certainty when it comes to crime is that boys and men are more involved in criminal behavior than girls and
But aren't
women.
the girls catching up? I thought I saw some recent studies in Australia.
It's a bit of a false premise, I think. They may be, certainly females engage in crime, there's no question. But regardless of what country you look at, what age group, what type of data, boys are always going to be doing it at higher rates. And I think if we want to do something about crime, we need to know why that is. We don't want to bring girls up to the same level as boys. We want to bring boys down to the same level as girls, right? Now, this has no easy answer either, as it turns out. The curious thing is that many of the causes of crime are the same for boys and girls. When you have problems in your family, you live in a very poor, disorganized, crime-ridden neighborhood, that puts you at risk for crime. Not doing well in school is a risk factor. When you hang out with friends who are dabbling in delinquency and drug use, that puts you more at risk. Those same things seem to affect boys and girls. So that's curious. We don't have a lot of unique causes that affect just one sex or the other. What we do know, though, is that many of these risk factors are more likely to be experienced by boys. They have a little more freedom from rules and restrictions that parents place on their children, which are actually protective mechanisms. Supervising kids, giving them boundaries, enforcing rules. When you do that, kids are less likely to experiment with crime. And girls are subject to more monitoring and supervision and discipline typically than boys. Likewise, boys tend to have more friends who engage in delinquency and drug use.
Right.
So they're experiencing those things at higher rates.
So they're subject to more risk factors and slightly fewer protective factors, or is another possibility that boys are more susceptible to risky influences?
Yeah, actually both are operating at the same time. Many of these risk factors, while they affect girls and boys, they do seem to have a stronger effect for boys. Although curiously, some of the protective factors are also more protective for boys than girls.
Hey, you can see the practical implications of a lot of this research down the track.
Yeah, so this is, I think it has real implications for prevention. I mean, it just reinforces the point, though, that risk factors, when they're experienced, lead to crime. So we need to do something to minimize exposure to risk.
But also highlights the importance of the kind of fundamental research you're doing, just tracking kids longitudinally and looking at research that compares boys and girls.
That's true.
Yeah, and we just need to know more.
We have come a long way with the gender research, though. It used to be that we only cared about boys. Studies only included boys.
Well, the whole of society was like that.
Yes. So we're making some progress. But we haven't figured it all out yet.
Well, look, beyond those very erudite and really useful and interesting projects, what else do you like to do in your life? And are we going to see you back here in Australia?
I hope so. Now that I'm affiliated with the Institute, I hope to come back and do more collaborations. You and I have talked about some potential papers we can write together.
Right.
I'd love to hear more about how your initiative plays out in the future.
Yep.
I also just love Australia. It's a really friendly country to visit. I like bushwalking, as they say here. I was able to visit some of your beautiful beaches during this visit and look forward to doing more of that in the future.
Excellent. Well, Dr. Abby Fagan, it's been a great pleasure to have you here, and we'd love to see you again soon. Thank you.
Say the word, I'll be back.
Great.
Thank you, Ross.